Well, a 35-year-old wife and mother has died from drinking too much water. Ashley Summers told her family she was feeling dehydrated after spending a day at the lake. She was so thirsty that she drank half a gallon of water in just 20 minutes, and she later collapsed and passed away at the hospital from water toxicity. Joining us now is Dr. Renee Matthews. Doctor, thank you so much for being here. I think the fear is, can this happen to anyone?
So it is extremely rare. People who are endurance athletes or who do a lot of strenuous physical activity are at higher risk, but this is very rare.
So, how much water are we supposed to drink? Maybe we can outline that first.
So there's a whole lot of factors in how much water a person should drink. The biggest thing with Miss Summers was that she drank half a gallon in 20 minutes, which you can imagine is a lot of water. That's 64 ounces. So basically, everyone says we should drink eight-ounce glasses of water a day. She drank all of them in 20 minutes. So that's why she, that's where the water toxicity came in.
Got it. And what signs do people need to look out for, especially in these brutally hot summer months?
So if you have headache, confusion, fatigue, low energy, low blood pressure, muscles twitching, cramping, restlessness, bad temper, these are signs that you might possibly have hyponatremia, which is what happened, low sodium. And so it's really important that we have our electrolytes. And I'm sure we've seen the commercials of these electrolyte drinks out there. That is what they are there for people that if you just get that hot and you're that, need that thirsty, you need electrolytes. So that the problem was that she just had no sodium in her system. And so that low sodium caused her body to just not be able to get rid of water.
So is there any way, if you are feeling that thirsty, to safely hydrate, potentially without drinking that much? And I know the short amount of time was really key here.
Yes. So don't drink as much as she did, of course, in that short amount of time. But also, if you can get one of these electrolyte drinks or something that has some other, electrolytes in it, that is probably key.
Okay, great advice. Thank you so much. I'd also love to get your take about a new drug the FDA will be voting on tomorrow. It's being called a game changer in the treatment of depressive disorder and postpartum depression. So patients in trials saw their symptoms reduce dramatically after only 14 days of taking zuranolone. And the World Health Organization says 5% of all adults suffer from depression. 1 in 8 women experience symptoms of postpartum depression, according to the CDC. So how big of a deal could this treatment be?
This is actually a really big deal because this is only the second drug on the market that treats postpartum depression. The other treatment requires you to be hospitalized. It's an IV. This is the first pill. So that is why it's such a huge deal, because it's in pill form. You can take it at home.
And the pill's designed to take for 2 weeks, then stop. Do the results continue after a patient is done taking the medication? And women in trials were told they couldn't breastfeed on the drug. I would imagine that's a major downside for many women.
So yes, if you take you're supposed to take the drug once a day for 2 weeks, and the 15th day, your symptoms should be resolved and you should be in remission. You might have to, over the course of the year, take a couple courses of it, but compared to other antidepressants that take 4 to 6 weeks for you to see any results, this is amazing that they've seen this in the research. The other thing with the breastfeeding, I know, that is a downside, but I think when we look at the alternative and how many moms we've lost to postpartum depression or psychosis, I think that this is actually probably a good deal. And also, the research is still out. So perhaps they are going to let moms breastfeed, because they didn't let the people in the trial breastfeed, but they did not also do any research to find out, was it in the breast milk? Does it affect, milk production? So that is the key. So I think later down the line, we might get more information about that.
All right. Dr. Renee Matthews, thank you so much for your insight.
Thank you for having me.